Hi everybody, I'm Andrea Cameron from 10 TV, and I'm here to talk to you about controlling the spread of infection. As healthcare professionals, you have to take special actions, not only to help patients get well, but to keep them from getting even sicker. I hope that you recognize how important this is, because consistent infection control practices will also keep you and your coworkers from getting sick. Disregard for infection control practices could have devastating results. This is everyone's responsibility, so we all need to do our part. First off, to help us understand how we can prevent the spread of infection, let's take a look at who is most susceptible to infection. People who are very old or very young are at great risk. So are patients whose immune systems are compromised by their disease or treatment. For example, patients receiving chemotherapy and patients with AIDS have weakened immune systems. Surgery also increases a patient's risk for infection, as well as invasive devices like IVs or tubes. Finally, as hospital staff, you are susceptible to infection anytime you are at work. So, how do we combat these infections? Let's ask William, our man on the floor, if he knows anything more. Are you out there, William?
I'm here, Andrea.
Did you hear what we were talking about?
Yeah, that so important topic of infection control. Everybody needs to understand the ins and outs of preventing the spread of infection, so pay close attention. First, let's look at what causes an infection. We call this the chain of infection, and any part of the chain can be broken to prevent the transmission of infection. The first part of the